Hello and welcome to Andean Medical Mission. Welcome to our series Beyond 2020, the series where we look at everything to do with blindness prevention and eliminating of avoidable blindness in countries with developing healthcare services. This talk is aimed really at non-ophthalmologists. It might apply to junior ophthalmologists in terms of some of the roles, but I want to look at some of the support functions to a surgical team that would be available as volunteer roles, either in the UK or in our case in Northern Bolivia. So let's talk about that. In today's talk, we're going to look at volunteer roles for organizations that are involved in mainly cataract surgery, but providing ophthalmology services in remote locations in countries where there are developing eye care services. So we're going to look at the roles that you might be able to acquire as a volunteer, and we're going to look at how likely it is that that role exists, how valuable it is to the organization, and I'm going to give you some ideas, if you like, of things that you might want to volunteer for in the future to help this global effort of reducing blindness across the world. There are three roles that I've identified as being very likely to provide you with a volunteer opportunity without even leaving your country that you're living and working in. The first of those is fundraising, and there are many opportunities for fundraisers right across the board, whether it's collecting at events, or it's doing talks, or it's writing letters. There are many opportunities for fundraisers, and yes, it's incredibly useful to the organization to have a number of people collecting funds in different ways. For us as a small organization and a very efficient organization, it costs about £10,000 for us to operate on 100 people. So just to give you a context, there's quite a lot of money required to go out and do what we do. And fundraising, you definitely have a lot of interest. If you're good at that type of thing, then yes, there'll be a lot of interest from NGOs to have your support and have your time and your efforts. It's very needed. So it's a 3 in terms of the need, and it's a 3 in terms of you're very likely to be useful in that type of role. There's a second area which I will call administration, and within this you have some legal work, and there's quite a number of roles that are required to administrate even a small charity like our own. So things like every time we go into Bolivia, we have to get permissions to do what we do. So we need to collect the qualifications of the surgical team. We need to make sure that they're registered, they're qualified, and we need to translate all of that documentation into Spanish. We need to get that legalized, we need to get that notarized, and then we need to present all of that information to the Ministry for Health, in our case Bolivia, and get a letter of permission back from them in a timely manner, so that we can go ahead safely and correctly with the surgical work that we do. And there's quite a lot of admin involved in getting that process up and running. So if you're interested in that side of things, in doing some admin, if you perhaps have a legal background, making sure that organizations are compliant, there's plenty of roles, I would think, in that. And it's important work. I would say it's a 3 and a 3. Yes, there's a great value to the organization having help in that respect. And the final area where you might find some volunteering opportunities is with logistics, and that would be collecting equipment, collecting medicines, collecting consumables, packaging things, getting items in a good state to the team that are traveling, or if it's larger quantities of items, actually getting those items posted into country with all the legal permissions and everything involved. And there's quite a lot of work that you can do, visiting hospitals, visiting manufacturers of products, and in terms of collating good logistical support for a charity, I think there's some opportunities there, and that's valuable. And I would say that's a 2 in terms of its value, and probably a 3 in terms of the value, the likelihood that you would get work as a volunteer in that respect. Then we have what goes on in country, and before the arrival of the main surgical team, there's quite a lot of work that's required to get things ready for them. And again, I've identified 3 areas here where potentially you could get a volunteering role and where you could be very, very valuable. The first role is in getting the ambience, the place of work ready for your team to arrive. So you need to set up a clinic and a theatre. Now you might be lucky, you might be working with an organisation that has an ophthalmology unit already there, in which case this isn't applicable. But if you're the NGO that you're looking to join works similarly to how we do in Northern Bolivia, we don't have ophthalmology suites that we can walk into. We don't have theatres that are set up for ophthalmology at all. Some of the operating theatres that we work in don't have surgery carried out at all, other than when we're there. So there's a room and it's empty, and we have literally to go in and start totally from scratch. And there's about a week's work that's required before the arrival of the surgical team to make sure that we give them on day 1 a working operating theatre, which means that it has good electrics, that the air conditioning is clean, that we're not pumping dust into the room, that everything in the theatre has been taken out, everything cleaned, and only what is needed is put back. If you have light fittings on the ceiling, and fans and things like that are hanging from the ceiling, they are just areas where dust can collect, and you either have to clean them incredibly well or remove them even better if you can do that. And I don't mind just a bare bulb in an operating theatre rather than a long strip light, which can potentially harbour lots of bacteria, lots of dust, lots of inflammatory materials could potentially get into the air from light fittings and fittings that are on the ceiling. So getting all of that ready, making sure that all the medicines are put out, making sure there's an order, getting the operating bed in the right place, setting up the microscope, setting up all the equipment that you're going to require in the operating theatre takes a little bit of time. And roughly we take about a week to get it absolutely from zero, from a not at all clean operating theatre to a workable operating theatre. Takes about a week, and that is a job that any conscientious person could get involved with. And so I would say that is, in terms of a necessity, a 3. Likelihood of you getting that as a role, it's quite a long way to travel just to do 1 week of work. So if you could combine perhaps this role with something else, that would be probably, you'd be more likely to get on a trip. But it's certainly something that's required before the arrival of the team. There's also a role in screening patients before the main team arrive. What you want to have is a surgeon arriving, let's say, on a Sunday and being able to operate on a Monday, and not spending time hunting for patients for that very first day. So I normally try and get 2 or 3 days full before the team even arrives. So we're just looking for people with obvious cataracts that don't look too complicated, obvious pterygium, obvious skin tumours in terms of what we largely do, and just getting 8 to 10 people on the list each day. We'll add to that list as the day goes on, but just knowing that at 8 o'clock in the morning there is someone already waiting to be operated on just means you don't miss that day, particularly if you're just doing a 10-day trip in a zone. You don't lose 10% of it whilst you're hunting around. So having screeners, people that can go out before the main team arrive and find patients is really useful, and that is a 3. And I think that's a 3 in terms of likely to get a role doing that. That would suit a junior doctor, a GP, an optometrist, an ophthalmic nurse, not orthoptist. There are many people that could do that role, and it's very, very useful to have that list full right from day one. Having excellent equipment, well maintained, set up properly, and in working order throughout the whole trip is really important. And if you have maybe somebody come before the arrival of the surgical team and get things ready for you, that gives you a big advantage on day one when you want to get that operating list underway if everything is working well. This could be a role for an engineer, it could be a role for an electrician, or anybody who's quite technically savvy at just making sure that everything is plugged in properly, switches on, that it's protected from unstable currents, which often exist in these small villages where electricity is provided by a generator, and then sometimes it's switched on, switched off as fuel is added to the system. So having all your equipment protected properly, and if something doesn't turn on, having someone to go to who can get it working again quickly, that is an important role. And again, that's a 3. In our case, we've worked with the same equipment for a number of years now, so probably wouldn't actually have a role for somebody doing that unless they were, you know, a Zeiss engineer or somebody from Volk or whoever. But those people, I'm sure, would know the equipment a lot better than I do. But that is a role, and if you are technically savvy, I think you could potentially write to some organizations and offer your assistance. So that's a 3 and maybe a 1 in terms of how likely you are to get a role, but definitely possible. Let's look now at the arrival of the main team and the roles that are required to support the surgical team to get the maximum out of the trip and to have the best outcomes for your patients. So lots of roles here, and to go through them quickly, a translator, something that we have every year. I bring UK surgeons largely, and I don't mind if they don't speak Spanish. I want the best surgeon that I can possibly get, and I'm happy if they don't have language skills, because we'll bring a translator with us. So that is a 3. Absolutely, we have to be able to communicate with the patients, and of course it's a 3 in terms of the likelihood of a role. Every single year we have roles as translators in the teams that we run. Screeners, again, that's a role. So we have the screening that takes place before the arrival of the main team, and then we have to screen all the way through the 2 weeks that we do in each town. And so we're constantly trying to find the people with the most need, and that means you've got to get through those people that are genuine concerns about their vision, but there isn't something that they require surgery for. So things like presbyopia, dry eye, they're all important things which you try to move those people through relatively quickly to identify the people you can actually operate on and get an improvement in vision for. So screening, yes, 3 and a 3. You definitely get roles as a screener. So the runner in theatre is also a role. So you don't have to be medically trained for this, but you do need to have a good understanding of how to move around in an operating theatre, particularly if there isn't an ophthalmic nurse. So we tend to use one surgeon operating, assisted by a second surgeon, and we don't have a sister or a theatre nurse that we bring ourselves. We use the Bolivian theatre sisters, but of course they require some training, and there's a language barrier in terms of requesting items and getting them correctly and quickly. So having a runner in theatre is a useful role, and again, junior doctor, medical student, that would be perfectly suitable person to have that role, and that's a 3. You cannot have a theatre. Well, you can, but it's much more complicated. If you could have the theatre assistant not actually with gloves and the surgeon taking all their own instruments, of course you could do it that way. But it's a useful role to have somebody who can open packets and bring you things as you require them during the operation in a safe and clean way. Refraction, that's a really interesting support function because there is a model which looks, it's a 3S model where you look at the selection of the patients as being important for measuring outcomes, the skill of the surgeon as being super important, and then spectacles is the final S in that model. And if the idea being that if you refract after surgery, you're going to get a much better final audit. So you're going to be able to say that you've helped to a higher degree by refraction. We have had optometrists come with us on our trips, and it has been incredibly useful to have that ability to refract quickly. Ophthalmologists can do it, but they're generally slow. It is a role potentially, especially if you go to a bigger organization that actually specifically does glasses, then roles as an optometry, roles in refraction would be required. We use it from time to time. You know, if we've left a patient aphakic, it's quite useful to give them a better measurement than just a guess at a +10. And we'll often meet kids that, you know, need -5 lenses and things like that. And if you have the ability to make your own glasses as well, which we do, but we don't use it all that often, that can be quite useful and quite impactful as well. So I would say that's a 2 in terms of how valuable it is to an organization, unless it is a big organization that specializes in refraction. And in terms of a likely role, yes, you could come to do refraction, but you could also screen, and if you had a language skill, be a translator as well. So you almost definitely, if you can refract, you can almost definitely get on a trip like this. There are a number of roles that are just pure logistics, things like driving, things like we have a pilot. It's perhaps that not that available as a role, because we have one specific pilot who we use all the time because of his knowledge of remote landing sites in Bolivia. But drivers, certainly, people to move equipment. There are volunteer roles in that respect. We, as an organisation, the Andean Medical Mission, don't tend to bring people just for that. We try and buy in help from the local communities and get people to do those types of roles for us. So useful, one, not crucial, and likely to get a role just to do it. It would have to be something really specific. 2 weeks have gone by and we've done 100 operations, and now the surgeons have gone home. And what happens next is a really important question. I wouldn't recommend to any organization just to leave it there, to take your photographs and shake hands and have a party on the last night and go home. You need to do follow-up, and that follow-up is really key. There are a number of dates that you need to be present in terms of the follow-up. I think you need to do a follow-up for at least a week after the surgeons have gone. If you're going to get an infection, it's likely to present in 72 hours, and you're going to need to manage that. But the patient, it might present in 72 hours, but the patient might live a day away. So by the time they pick it up and they get to you, it might be 4 days, 5 days. So you need to be there for a consistent amount of time following the main team leaving. And therefore there's a role there for maybe more than a screener, somebody who can examine the retina, somebody who can give ideally an intraocular injection if it's required, and that first week having somebody on board is pretty important. It could be someone who travels out specifically for that role, or you could work with a local ophthalmologist. You need to be there at week 1, and I think you need to be there at month 1 as well. A review at a month following their operation is a sensible period of time to be back and to be just checking to make sure that every possible complication is managed well. Teaching is something that we do, but I don't think it needs to be a separate function. I think it can be something that one of the main surgical team could do during the trip, and so to bring somebody out just for teaching on the type of work that we do wouldn't be something that is required. But if you were going to work in a city where there are ophthalmologists and you wanted to work with them and improve their skills, then yes, if you came, maybe you're not currently operating, but you're a retired ophthalmologist or you have a lot of experience in a certain field, then joining an NGO to do teaching is a role, and that can be apart from the major surgical campaign. We wouldn't use it particularly, I don't think, because we don't have very many ophthalmologists to actually train in the area that we work. But we do teach local doctors how to manage the patients after we've gone. So if they see signs of, of infection or patients are unhappy, we teach them what they need to do, and most importantly, just how they can communicate with us. And we make sure that local doctors have a supply of medicines that are likely, that potentially would be helpful to them should something occur. So teaching, valuable, yes, it's a 3 in terms of value, but to get a role teaching with us would be quite low. But potentially with someone like Orbis or some of the big charities that really focus on teaching ophthalmologists to be better at ophthalmology, then yes, that would be a 3. So I think it would just depend on the size of the organization. The final area that I want to talk about is project work, where no NGO is actually present. So a little bit like how we set up. Andean Medical Mission looked at Northern Bolivia, realized that there weren't any services here, and we set them up from 0. That was 15 years ago, and we've now done 2,000 operations, and we've probably helped over 10,000 people in this area. So there is an opportunity as a volunteer to set things up as well in areas where no services currently exist. And there are projects that are quite simple that you could do. For example, the distribution of vitamin A can be very useful in preventing corneal blindness. You need to do it properly. You need to research the area that you're going. You need to make sure that that is an area that you're needed, and that you're not stepping on the toes of other projects or the work that the Ministry for Health is trying to do in that area. But if you find an area where there is a clear need and no one is doing anything, then there's a simple project there that you could put together and create your own impact, if you like, on preventing blindness in patients from lack of vitamin A. We don't do vitamin A as a tablet in Northern Bolivia, because we are on the edge of the Amazon jungle. We eat a lot of fish in that area, and our diet it contains quite a lot of vitamin A, so it's not required. Projects like vaccinations against blinding diseases are also areas where you could potentially set up your own project. Again, if you're going to do this, you need to do it well. You need to do it with the permission of the Ministry for Health of the country that you're working, and you need to bring with you qualified people who can make the appropriate records for those patients. So you don't want to be going in with your own paper system that doesn't tie up with the healthcare system in the area. You need to be able to write down what you've done. You need to be able to note which patients have received vaccines and when and what doses and any reactions to them that they've had, and that needs to be recorded properly. So if you do a project like this, you need to do it, and we do it regularly. We did a big COVID vaccine project when COVID was prevalent in Bolivia, and since then we've done a number of vaccine trips for German measles and measles and polio as well, which we just add in at the same time. But those are all possible. So if the project that you think would really suit you doesn't exist, then I would encourage you to perhaps think of creating something yourself. And if you would like to contact us for some ideas, feel free. I'd be very happy to discuss it with you. But as I say, if you're going to do it well. So that's the end of this talk. Hopefully I've given you an idea of some of the volunteer opportunities that exist for NGOs or within NGOs. Hopefully you will find something that suits you, and that you can get involved in as well in trying to eliminate avoidable blindness across the globe. So if you enjoyed today's video, and found it useful, then please subscribe to our series. I've got a number of videos coming up, and it would be great to have your comments and your thoughts as well on this video or any of the others in the series that you might watch. So thanks again for tuning in. Thank you for staying. If you've stayed this far, I appreciate that, and I look forward to seeing you again on the next one.